Hi, everybody. Welcome tonight to our webinar for Low FODMAP 101. My name is Theresa Zangerle McArtin. I'm a registered dietitian here at Premier Medical Group. And I have worked for the past about 8 years, primarily in GI studies and GI offices. So I'm very familiar with the low FODMAP diet as well as IBS. And I thought that this presentation would be perfect for this month because it is IBS Awareness Month. And many people suffer from IBS, and some people just don't really want to talk about it or don't really want to say anything about it because it's kind of personal, right? Who wants to tell everybody that we're either, pooping or not pooping? So tonight, I'm hoping to help some of you shed some light on IBS and why we're using the low FODMAP diet, which kind of now turned into the gold standard for IBS. So I'm going to get this presentation started. It's a couple of minutes after 6. Any questions anybody has, please feel free to put them in the comments section, and I will try to answer them all at the end. And any further questions you have too, you can always call the office if you need to book an appointment or anything like that. So let's get started tonight. So when we have IBS, some patients come into my office and tell me this is how they feel. And if any of you out there tonight have IBS, this may be how you're feeling. So somebody is looking at, a big salad and you're looking, oh my God, that looks so good. And it's so healthy for me. And why wouldn't I eat this salad, right? And then a couple of hours later, golly gee, I sure do hate salad. This stinks. Not going to use that word. And it's because of their IBS, a lot of times that they're feeling that way, that a lot of times food that we feel is good for our body and nourishes our body and makes us feel healthy, and we equate it with good health, a lot of times people with IBS cannot tolerate those foods. But now we're seeing that, well, it may not be those foods that they can't tolerate. There may be something in that food itself that that patient cannot tolerate. And that's where the low FODMAP diet comes in. Now, there are a lot of different diets out there today. There's the paleo, the keto, and they kind of tote IBS, especially paleo, that they help with all digestive issues. But I can tell you the low FODMAP diet is scientifically proven now to help with IBS, and it is our gold standard of treatment. So why do we use this diet? So one of the reasons is IBS can affect up to 1 in 5 Americans. That's a lot of people if you think about it, 1 in 5, right? And it's characterized by gut symptoms, including bloating, abdominal pain, gas, right? Change in bowel habits ranging from diarrhea to constipation. And we call this IBS-C, which is IBS with constipation, right? Some people have IBS-D, which is IBS with diarrhea. And the lucky people, I always say, have IBS-M, which is a mix of both symptoms. And a lot of my patients do suffer from IBS-M. And symptoms a lot of times can lead to reduced quality of life. I can tell you I have patients that have told me stories that they have tried to go on car trips and they had to know where every bathroom was across the way, or they had accidents in car trips, so now they're afraid to go, or they have to keep changes of clothes with them just in case they have an accident. So IBS is something that 100% affects the quality of life, but because of what it is, I feel like a lot of us are very afraid to talk about it. And it's important to have an open dialogue with your physician or your dietitian about it, because this is something that if we can help you and we can improve your quality of life, I think that's a win-win. So what does the low FODMAP diet stand for? Why do we use it and what does it do? Don't worry, I'm going to tell you now, you're not going to be quizzed on this at the end. So what FODMAP actually stands for is fermentable, oligosaccharides, disaccharides, monosaccharides, and polyols. Again, not going to be testing on it. You don't have to remember it. These are all words that I barely wish I'd have to remember. So what are FODMAPs? So what that really means, what all those big words and all those that mess over there means is FODMAPs are carbohydrates, which are sugars that are found in the body and in these foods, right? But when we generalize it and say FODMAPs are carbohydrates, many people then tend to say, well, if I'm on a FODMAP diet, I can't have carbs. Well, that is not true. A low FODMAP diet is very specific in what you can and cannot have. And a low FODMAP diet is actually called an elimination diet because you are on it for a certain duration of time, and then we add foods back in. So we take out specific foods, not generalized. It's very, very specific. And then we will slowly add those foods back in, and we'll talk about that a little later. So what do these carbohydrates do? So why am I telling you to avoid things? Because I'm always the person to say, as a dietitian, if I'm telling you to avoid something, you better really know why you have to avoid it, right? Because I like food and I want to keep food in my diet. So the reason we're avoiding these fermentable carbohydrates, right, is because these FODMAPs can pull water into our intestines. And by pulling water into our intestines, you can get the feeling of bloating, cramping. Symptoms can range from diarrhea to constipation. And it's a lot of times, and sometimes can be contributed to bacteria in our small intestine. So two separate issues, right? IBS and small intestine bacterial overgrowth, they're starting to intertwine a little, but FODMAP diet is used to treat both of them, okay? And the FODMAPs are sometimes considered like fast food for our gut, where our gut is processing them very quickly, but then causing these symptoms on the back end. So what happens when these symptoms happen is you get a feeling like this. And I can tell you, I have had patients that have come into my office that look 9 months pregnant, and they are not 9 months pregnant. And the worst thing I could tell you as a woman that somebody wants to hear is somebody come up to you and touch your belly and say, hey, how far along are you? And you're like, well, I'm not pregnant. What are you talking about? But with IBS, a lot of times this is how my patients feel, and not only for women, but a lot of times for men too. As the day progresses, sometimes they feel that the symptoms get worse and worse, especially with bloating, as we put more food into our system. And by the end of the day, they feel like they are 9 months pregnant or have this big weight around their gut. So this is the FODMAP diet. So this is like a little diagram I thought would be good to kind of explain what's going on, right? So we have our small intestine, our large intestine, kind of gas building up in our large intestine. And the FODMAPs are going in and creating all this feeling of gas and bloating, because we have sometimes, and this is where like sometimes I say that bacterial overgrowth can cross-intersect with IBS and kind of cause IBS-like symptoms we're finding in some of our patients, is that the FODMAPs come in and are actually feeding the bacteria that actually crept in from the large intestine into the small intestine. So we have all these problems going on, which creates symptoms of gas, bloating, diarrhea, constipation. Okay. So now, okay, we're going back to the diet part. I'm telling you to avoid these foods. I'm saying, you know what, you may feel better. Let's try it. Let's give it a shot. And you go, okay, so where are they found? So now we're going to get into the groups that we are going to be eliminating. And there are 5 different groups. So there are fructose, which is found in carbs like fruits and vegetables and some added sugars like honey and agave. Lactose, that's found in, of course, dairy products, and goat's milk is on this. Fructans, found in many foods, including gluten-containing grains. So like think of like whole wheat bread, white bread. Spelt, barley, and rye. Also, fructans are found in onion and garlic, which is the hardest thing about this diet, is taking out onion and garlic. Broccoli and asparagus and artichokes, and we're going to kind of build upon this a little bit as we go through this lecture tonight. Galactans, which is basically beans, and polyols, which are sugar alcohols, and they're also found in some fruits and vegetables. So the sugar alcohols, think like Tic Tacs, Mentos, things like that. Trident gum, those things that have xylitol in them. And also some fruits and vegetables, those would be like blackberries, cherries, peaches, and there would be cauliflower, green peppers, mushrooms. So as you can see, it is very specific. So each group that we're taking out, it's not just I'm telling you to take out all fruit, it's very specific. Fructose and the amount of fructose in an item. Lactose is we are taking out all lactose. Fructans, derivative of fructose, and things like, you know, again, onion, garlic, broccoli, asparagus, artichokes, beans, and the polyols. So now here we're thinking about all the different FODMAPs, the fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, right? So all these different things we're going to be taking out. And as you can see here, there's broccoli, right? There's Brussels sprouts we take out. There's the bread, there's the beans, the lactose, the honey, apples, and avocados. Are all these things that we're going to be pulling out of the diet. So for fruits, now when we're thinking of high FODMAP things and high FODMAP fruits, these are, it's a snapshot. The list is actually a little bit more, it's a little bit more intense, but this is kind of a snapshot of the biggies that we take out that I feel like a lot of people have trouble with. So like apples and apricots and blackberries and cherries. Any canned fruit, because the canned fruit has a higher fructose content because it's sitting in its own juice. Dates, figs, pears, peaches, and watermelon. So all of these fruits we are going to eliminate to your diet, right? So right now, if we're thinking about it, all right, we go, okay, I'm taking out fruits. All right, so that's the first thing, right? So we're checking off the list of fruits that we cannot have. Then we go to sweeteners and they say, I'm going to tell you, okay, we can't have the fructose. So like think high fructose corn syrup, right? Can't have that. Think honey. We're pulling that out. Think all the sugar alcohols, again, that can be found in like diabetic products and can be found in gums and Tic Tacs and things like that, right? And then from there, from the sweeteners and the fruits, we're going to move on to dairy. So we're taking out like most yogurts, although we do allow Greek yogurt, plain Greek yogurt. We take out ice creams. We take out soft cheeses like cottage cheese, ricotta cheese, mascarpone cheese, sour cream, and whey protein supplements. Now, I am going to tell you that you can use lactose-free products. So yay, there's like a bright horizon there. And these are all the big veggies we're taking out. So again, the list is a little bit more extensive. If we were to sit down for a one-on-one chat about this, there'd be maybe a few more things on that list, but this is kind of a snapshot. So we take out like artichokes, asparagus, broccoli, beets, and Brussels sprouts, and cabbage. Savoy cabbage is very specific. So not the one that's tucked that we normally use for like corned beef and cabbage. It's the one that's a little bit crinkly. Cauliflower, garlic, fennel, leeks, mushrooms, okra, onions, peas, and shallots are all coming out. We take out beans. So I always say all beans, although you can have like 1/4 cup of lentils is okay, and 1/4 cup of chickpeas. And wheat, barley, and rye. So what this means is that we do kind of switch over to a gluten-free diet. Why this diet can be potentially a little bit tougher than a gluten-free diet, actually a lot tougher in my opinion than a gluten-free diet, is because now you have to look for all those other things that we just mentioned, like the honey and the high fructose corn syrup, and make sure that the item is not only gluten-free, but then doesn't have the honey and the high fructose corn syrup or apple concentrate in it or anything like that. So it's kind of a little bit more intense. So this diet really relies heavily on label reading and knowing what to look for on that label to be successful in the elimination phase of this diet. So beverages. Now I could tell you we take out like milk. I could tell you all of these beverages listed up here are low in FODMAP, so like vodka, gin, whiskey, even a beer, but the alcohol is always limited to like 1 to 2 beverages, and that's it. The one thing I always tell people to stay away from is anything that has like a fruit juice in it, any like daiquiris or anything like that that's very sweetened. A lot of times there's high fructose corn syrup in it, and the fructose content itself may just be higher, so we just pull that. So now when we're looking at things, right, we're going to kind of go back. Sorry. We're going to go back here a little bit. I'm going to go back to the fruits, right? So I'm telling you all these things that you can't have, and the apple is sad, right? But now I want to explain to you things that we can have. So things that we can have is you can have cantaloupe. You can have honeydew. You can have bananas. You can have blueberries. You can have strawberries. You can have oranges. So there are a lot of fruits that you can have. And the reason I want to stress that is that this diet, if it helps make you feel better, a lot of my patients tell me within a week, they sometimes feel like a 90% resolution in symptoms on this diet. Now, it's not without, making some sort of sacrifice, and the sacrifice is we're eliminating these foods. But the diet should never make you nutrient deficient in anything. So when you're looking at it is, yes, I can have these, but I always say we also want to focus on what we can have. And we can have fruits. We may not be able to have apples or pears or blackberries or cherries or dates or figs or peaches, but we can have pineapple, and we can have strawberries, and we can have oranges, and we can have blueberries, and we can have honeydew, and we can have cantaloupe. So we want to focus on the things that we can have in each subgroup as well. you know, and not just focus on the can't. Because if you keep on focusing on the can't, who's going to want to do the diet? We got to look at what we can do as well. For sweeteners, actually, what you can use is regular sugar. Regular sugar is 100% fine. And you can use stevia too. Stevia and stevia is all fine. So you can use the other artificial sweeteners as well. They're fine. For dairy products, okay, so kind of I like to go through each group to say what we can have. Again, let's focus on that, because otherwise you're not going to want to do this and you're not going to feel better. So the things that we can have for dairy is you can have lactose-free products. So you can have lactose-free milk. You can have lactose-free sour cream. You can have lactose-free cottage cheese. They sell them. Lactate makes them, okay? You also can have coconut milk. You can have almond milk. You can have rice milk. And all of those items too, like the coconut and the almond milk and lactate as well, they all make ice creams that are non-dairy as well. So as long as the ice creams fit all the other parameters, you can still keep ice cream in your diet. It's just maybe a different kind of ice cream. Vegetables. So there's a big list right here, right, of things we can't have. I want to focus for a minute on the onion and the garlic, because to me, those are the hardest things, because they're found in absolutely everything. And we can't use onion powder and we can't use garlic powder on this diet. But one thing to focus on is that if you were to take the onion and the garlic and you were to saute it in a little bit of olive oil, and then just remove the pieces and use that olive oil, you can use that olive oil to season things, and that would be fine and FODMAP friendly. What you couldn't do is consume the big pieces, and you couldn't put it in water in like a soup or a sauce and do the same thing. So you can use that oil though, and they do sell infused oils. The other vegetables that you can have is you can have zucchini, you can have lettuce, you can have celery. You can have some sweet potatoes. You can have regular potatoes. So there are a lot of things that you can have. You can have water chestnuts. Like I said, there are a bunch of items that are still on the list. Green peppers you can't have. You can do red, yellow, and orange. So again, it's not going to make you nutrient deficient in anything, but it'll hopefully make you feel better, and you just focus on the things that you can have. For beans, like I said, we do pull out all the beans, but again, you can do 1/4 cup of lentil, 1/4 cup of chickpeas. If you are a vegetarian or vegan listening to this, I can tell you I have had vegans and vegetarians follow this diet, and what I do is I tweak it for them, because beans a lot of times is a big part of their diet and it's a staple for them. So I will tweak the diet according to what my patient's needs are. So now we're talking about the wheat, the rye, and the barley. So a lot of people go, oh my God, I'm gluten-free. And they go, okay, well, there's a lot of gluten-free products out there. And when I say, wait, hold on, we have to read the labels too, it kind of gets a little overwhelming. Well, I could tell you, if you do rice, potatoes, those quinoa, you can do oats, those are still okay on the low FODMAP diet. A lot of gluten-free pastas are okay. The ones that aren't are the ones that contain beans. So like lentils and chickpeas, we do omit them. But if it's a rice-based, a corn-based, it's okay. Corn chips are okay. So like tortilla chips or corn tortillas are fine as well. And there are a lot of gluten-free breads out there that are fine as well. We just have to fine-tune that label and just take a peek at it. And the beverages went over, so these are the ones that you can have. Water, tea, coffee is still allowed on the low FODMAP diet as well. So now these are kind of just some swap outs ideas. So like if you garlic, you can use the garlic infused oils, onions, the green part of the scallions, the bread, the gluten-free bread, milk, almond milk or coconut milk, and apples, fruits from the approved list. So again, just kind of just going over, like, let's focus on the positive, the things that we can have. These are some low FODMAP containing condiments that we can have. So like oyster sauce, soy sauce, even though it has wheat, is low enough that you can use it, but they also make like Bragg's Aminos and tamari, which is great as well. Mayonnaise, miso paste, mustard, Worcestershire sauce, balsamic vinegar, all okay. So I like this little caption is, don't worry, the low FODMAP diet is not forever, because it's not forever. I can tell you most of the time, I put my patients on the low FODMAP diet for 4 to 6 weeks. I don't expect them to be on it longer because it is an elimination diet. So with being an elimination diet is I want to see how their symptoms are going to be, if they're going to start to improve. And if they're not improving, then I don't like to keep patients on that diet. So how long? So again, the diet should be followed for no longer, usually about 2 to 6 weeks, and then the reintroduction phase starts. So the reintroduction phase depends upon how the person is tolerating things. And sometimes I could tell you if like you have IBSD and it's severe and you get triggered, a lot of patients tell me that they don't want to retrial foods certain times, like if they're going to work or what have you. So the retrial period takes longer. It's really just based on an individual of what they can do. So when we re-challenge the FODMAP phase, hopefully we have success and we find which area is problematic for you. Because most of the time I find for for the low FODMAP diet, it's not every group, it's certain groups and it could be certain things in that group that are problematic. So when we're reintroducing, we reintroduce a small amount at a time, and we kind of give you a break in between days as well, and we introduce one group at a time. This is like a quick snapshot of the reintroduction of the low FODMAP diet. So like on one day, it would be like a half a cup of mushrooms, 4 dried apricots, and maybe the person had minor symptoms. So like, and you're gonna monitor your symptoms. So then the next day would be a half a cup of mushrooms, 4 dried apricots, and continue to monitor. So that would be like week 1, week 2, you would do lactose, week 3, fructose. So it's kind of like a quick snapshot. I could tell you I don't do just one thing after another. It's normally like honey, and then maybe we'll do apples and we'll do pears another day. So it's different things. But we do start off a small amount and we work our way up. I wanted to kind of touch base at the end with everybody with like label reading because of how important. We just kind of went over all the things we can't have and all the things that we could have, right? So now when we're looking at it, it really comes down to if you're buying like a cereal or a bread, well, label reading and what you're looking for. So if we're looking at this and this label has pear fruit pieces, right, and apricot fruit pieces and pear juice and wheat, this would be something that we could not have. We'd have to put it back on the shelf because there are 1, 2, 3, 4 things in here, 5 things we couldn't have, 6 actually. I'm sorry, this is a little bit blurry, but I kind of wanted to show this one thing because it's sometimes hard to find and we don't normally associate it with fructose. But if something says right here, like glucose fructose, that is fructose and we cannot have it. Also, you have honey in here as well. Here, here's another one. This is like a regular tomato sauce. So when we're thinking tomato sauce, we do have to alter that, right? We couldn't just have any tomato sauce on a gluten-free pasta. They do sell low FODMAP ones. And the ones out there are called FODI. It's actually a product line that's out there. It's all low FODMAP. They make low FODMAP salsa, low FODMAP tomato sauce, low FODMAP dressings, and it's FODY. So if we're looking at here, we have mushrooms, we have garlic powder, we have onion powder, we have minced onion. So all of these things right here would be a no-go on the diet. Okay. Here we have brown rice flour, white rice flour, fruit juice concentrate, which is from pineapple, peach, and pear. So here we go, is a big no-no right there. So now that we looked at a little bit of label reading, so I just wanted to touch really quick at the end is some technology because we're in 2021, big tech age, and we can use certain things to help us. And one of the things that we can use is an app, and Monash University came out with an app. Monash University is actually the university that started testing FODMAPs many, many years ago, and they're still testing them today. They're still testing foods to see what the FODMAP content of the food is. And if you have this app, you can actually put a product in, scan products, and it'll tell you what group it's high in. So it's very useful, not only in the beginning, but when we're reintroducing each group as well to know which ones you can have and which ones you can't. So I would definitely 100% try to get this app if you're going through the low FODMAP diet. I know that was a quick snapshot for everybody. In a quick snapshot of the low FODMAP diet, like I said, it's a lot to go over in a short period of time. But please, if you guys have any questions, please put it in the comment section, and we can I can go through it now. So I have one person that said that they eat mostly a plant-based diet, chicken and fish, and still have issues with constipation. Drink a lot of water and still seems like when I increase my fiber, I feel worse. Any suggestions? Sorry. So with that, it might not be the fiber content. It might be other items that you're eating. You may want to talk to your doctor to see if you need to get tested for bacterial overgrowth. You might want to see if the low FODMAP diet would work for you, and you could trial it out. But it might not be the fiber content. You're kind of focusing on the fiber. And if you already tried something and that didn't work, then I would say that we need to try another dietary intervention. Another question, was just diagnosed with small intestine bacterial overgrowth about 2 days ago. Well, so really new. Started the keto diet 5 days ago. So all these avocados and cows should go off my list. Yes, so definitely go off your list. So like cauliflower, avocado, actually keto might not be the best thing. If you were diagnosed with small intestine bacterial overgrowth, I would probably say you might have to do a combination of, if you're on the keto diet before then, keto as well as FODMAP, and eliminate the FODMAP foods. Because the FODMAP foods are actually going to continue to feed that bacteria that's there, the small intestine bacterial overgrowth. It's actually going to continue to feed that. So if you don't get rid of those foods, even after the antibiotic, if there's still residual there and you continue to feed it, it's going to come back. Will the low FODMAP diet eliminate my need for an antibiotic? That's hard to tell. I could tell you some patients, yes, some patients, no. Some patients, the bacteria is so bad, we need it on both ends. So we need the antibiotic as well as the diet. So it just really depends upon the symptoms and discussing with your dietitian and with your physician. When we introducing foods, about how long does this phase last? The food triggers symptoms, what do we do? So the phase, again, can last anywhere from like a month, 2 months, 3 months, 4 months. I've had sometimes 6 months. And again, it's just because sometimes it's more of the availability of the person to willingness to add something in, maybe because of their work schedule or they're going away or something like that. Now, when a symptom happens, I always tell the patient, if it's just like minor gas and bloating because maybe you haven't had that item in a while, we work through it for a couple of days to see if the symptoms progress. Sometimes the symptoms don't progress and the bloating goes away. So we continue on. But if you get like diarrhea, severe diarrhea, constipation, we stop. And we stop normally that group and that item. And then we kind of get together and we go, okay, did you trial in items before in that same group, or was it just this one item that was bothering you? So it really, again, everything is always individualized with diet. Are there any sources for FODMAP info you can suggest we look at? So yes, so Monash University, M-O-N-A-S-H University, it has a wealth of knowledge. Anything out of there is 100% accurate. The reason I say 100% accurate is because if you look online, you will get items that are very contradicting. So one place might say, hey, you can have cauliflower, and the next place may say, no, it's not okay. Everything out of Monash is 100% correct. What do you recommend as far as probiotics? So probiotics it's very individualized. I do place patients on probiotics. Sometimes when we're doing low FODMAP, I won't just place you on a probiotic. I will say, let's hold off. Let's do one thing at a time, and we'll do maybe low FODMAP first and then see if we need the probiotic. When we're looking at the probiotic, though, it has to still follow the guidelines of the low FODMAP diet. And some probiotics do have lactose in them and other fillers. So you have to look to see which ones are going to be more beneficial for you. Garden of Life has a great probiotic out there that's just a probiotic and doesn't have any other fillers in it. There was a couple out there like Ubiome and BSL, but sometimes I know one of them had lactose, one of them didn't. I believe they're kind of going back and forth and taking things out of their products in the recent months. So you just have to really look to see what's in the probiotic. And again, I'm always the person that I always say one thing at a time. So if you're trialing the probiotic and trialing the low FODMAP diet and you start to feel better, you're going to play the guessing game of what one is really working versus what one isn't working. Any other questions out there? Well, I don't think there's any other questions. Thank you all for coming tonight. Oh, I'm sorry, there's one. How about a probiotic with SIBO? Probiotics with SIBO, no, I wouldn't do a probiotic just yet. I would wait, especially if you're on a course of antibiotics, and then you can decide, you can talk with your physician whether to put in a probiotic now. But if you were just diagnosed with SIBO and are on a course of antibiotics, no probiotics. If you guys have any other questions, please feel free. You can give us a call at the office number, or you can go online. We do, you can go online and book an appointment if you'd like. But if you have any other questions, you can answer them now. Otherwise, everybody have a great night. Thank you for showing up. Thank you for showing up for our IBS lecture for our IBS Awareness Month. And have a great night. And I'll see you next time.